Definitely a big question. Data doesn't change behavior. If so, then no one would be overweight, right? We've had scales for however long, right? And it's really about creating meaning in people's lives. And so the technology really should just enable creating that meaning, creating whether it's social connection or whether it's improving your health, and really should fade into the background of what you're developing. And so what I think, I can also echo is what Az was saying earlier, is just, it's really about emotional design and making people feel like, you know, chronology is their friend, right? It's someone that they could literally pull out of their pocket and can support them as they go through their really tough day because their Crohn's has been flaring up, right? Or their fibromyalgia is giving them chronic pain. Maybe I'll leave it at that because it was such a big question. I'm just going to answer it at such a high level as that and pass it on, yeah.
Let's see. I guess I'll give you a little example that we talked about. I was also at CES recently. They had a digital health summit there, and I was on a panel talking about technology for improving diabetes and the obesity epidemic. And I was mentioning that we just did a big post on my site about the increase of type 2 among children and young people. And we queried about 6 of the top physicians in the country who deal with that issue. And I'm saying not one of them said, oh, we need another data center. We need an app for this. We need this software. What they all said was, it's all about behavior in families. So if a child is at risk for type 2 or they're getting type 2, it's, you know, the kind of eating that's being done in the family, the fact that the family most likely is not physically active, and that when this child is diagnosed, you can't bring them in and say, you need to do this differently. It's got to be a family effort, and you know, because the environment in which they're operating is so important, and that's true for adults as well. So I mean, obesity is a systemic problem, right? You've got people who live in areas where there are 5 times as many fast food restaurants as there are grocery stores, you know. So, I mean, for my feeling is that design should be looking at these problems and then designing to help solve them. So maybe there is a technology tool that a family could use to get more active and to, together as a group, change their eating habits and get motivated to do that. You know, that's what we should be designing, is to the existing problems. And it sort of goes back to this example in the book, Made to Stick, where they talk about bright spots, and we shouldn't necessarily be looking at what's broken and how we can fix it, but what's working and how we can do more of that. So, you know, find those bright spots, find things out there that are working for people, the pockets where people are living healthier, and let's try to recreate that magic.
So I'd say in a sentence, the role that design should have in health is that design should make people want to do whatever it is they're supposed to do, whether they're tracking something or changing a behavior, learning a new routine. If we can design that experience, whether it's software tools, whether it's hardware, whether it's knowledge, really craft that experience so that people are incented and want to do it. I think that's the biggest impact that design can have. And looking at the history of healthcare companies, technology, insurance, hospitals, there's really been very little design applied to most of the things that happen in healthcare. So I think that there's a huge opportunity. We've started to see it in the past maybe 5 years, decade for some of the more innovative companies. But the idea of applying design to the health industry is really something that's just starting. Not surprising for health being a little behind in some of these areas. So the exciting part is that there's a lot of opportunity there. And I think that the very least that design has to do is reduce barriers. So maybe we can't make everything exciting, maybe we can't make everything that we do motivating, but at the very least, if we can reduce barriers to doing whatever it is that people have to do, that's going to affect the most change.